Welcome back to the MediMobile Podcast. I'm Emily, a marketing specialist, here to introduce today's episode. If you're new to MediMobile, we're a technology company that provides innovative solutions in AI automated medical coding to healthcare providers. It's our job to increase our clients' revenue and make their workday as easy as possible, whether they're a large hospital system or single physician. Today, we're discussing return on investment, also referred to as ROI. As you can read from our title, our customers see their return on investment in MediMobile within 1 to 3 months. That is extremely fast. Here to join us is our Director of Business Development, Lauren Hall. Lauren, let me ask one more time for good measure so we can drill it in. How quickly can customers see their return on investment with MediMobile?
Well, Emily, exactly as you stated, it's typically within 1 to 3 months. The measures that we have in place to ensure that everything is being captured is what makes that return so fast. Our efficient charge capture, the reduced claim denials, and the streamlined and very efficient workflows are what ensure that timeline is met within those 1 to 3 months.
And I'd say we've broken new ground on how fast we can see the ROI with our new AI automation. It entirely speeds up the revenue cycle. Can you give us a quick overview of all the ways our clients see their ROI?
Yes. So just like you talked about, some of the charge capture efficiencies, like the AI, are ensuring that all charges are captured and those missed billing opportunities are minimized, which is done utilizing our MDM feeds that we use connecting with the facilities, which in turn, because we're using the documentation created by the providers, it's ensuring that every billable document type or every billable encounter is billed out by providers. So right there, that's where they start to see that missing revenue minimized, is because they're billing for things that they should have been billing for all along. And we are actually able to ensure that all of that is coming through MediMobile. And then, of course, the reduced claim denials, which has to do with our AI as well. Our AI is making sure that what is being billed out matches what is being documented, which will minimize those denials.
Exactly. And we know claim denials can significantly impact a practice or system's revenue. What specific features of MediMobile contribute most significantly to reducing those claim denials?
So our accurate coding suggestions, which are generated by the automated CPT and ICD-10 codes, help to reduce those denials. Our team has worked tirelessly on our AI coding to ensure accuracy. And whenever there are questions, we provide feedback to our customers to thereby improve the provider's documentation. Our MDM level recommendations also contribute to the reduced claim denials. We're using the medical documentation to populate billable encounters to providers' lists and running the AI on those, ensuring that all billable encounters are being moved out and revenue collected from them. Actually, our real-time claim scrubbing, we are identifying any potential issues before submission and allowing those updates to be made.
Exactly. And going along after that, capturing every charge is probably the most obvious way to increase the revenue stream. So how does MediMobile ensure that every patient encounter is captured and billed accurately?
So we do automatically track and record patient encounters. All of that is done within charge capture, and depending on the workflow, again, that MDM documentation is a very good way to ensure that all billable encounters are accounted for. So we take that medical documentation, populate the patients, and that alerts the provider to create the bill. Or if you're using our AI system actually runs on it and provides the CPT and diagnosis codes for you. Additionally, our real-time data integrations with facilities allow the population of patients to a provider's list upon registration or completion of documentation. After everything is entered, we do have auditing and monitoring tools that allow administrators to review and verify charges. Another step with that reconciliation to ensure that everything possible is being billed out. Another really nice thing we have built into MediMobile are the notifications for any potential missing charges or billing errors. We have rules we can put in place to prevent billing errors. And then the most obvious step is those missing bill alerts when patients populate the provider's list because there is an anticipated bill. All of those things come together to ensure that our customers are collecting the maximum amount of revenue.
And now, Lauren, let's apply this directly to MediMobile and our customers. Can you share a success story from a client who achieved a rapid ROI using MediMobile?
Yes, so a specific customer comes to mind that within their previous system, they were solely populating patients off of the registration feed or the ADT, the demographic feed. So if a patient was not registered to the correct provider, there was a potential loss of revenue there. And then if a provider maybe completed several services for a patient, if that wasn't indicated within that registration fee, not all services were collected for. So this particular customer actually utilized population of patients based off of the medical documentation, the notes that are created within the EMR. And with that implementation, they were able to reduce their costs by a third. So first, they were earning significantly more revenue just based off of those encounters that had not previously been billed out. But also they were able to reduce some of the costs incurred, just their working costs, because our system is able to ensure that those billable documents are being billed for. I think another big piece of success with their implementation is our streamlined workflows. They were able to eliminate several steps that previously had to be completed by a person, which, those people were able to take on different tasks, which helped increase the revenue overall.
Yeah, exactly. And, our AI technology is a hot topic around here. And earlier we had touched on the time-saving automation, and especially with those streamlined workflows. Can you go more into how MediMobile automates the charge capture process? What exactly is it doing?
Absolutely. So, our goal is to completely eliminate charge capture from providers' workflow. The goal, and what we're seeing with the AI, is the potential to free up the providers to spend more time with their patients, not even interact with MediMobile. And how we do that is through data integration, our automated coding, the workflow, as well as our alerts and notifications. So in terms of the data integration, we connect directly with the facilities, and we are able to populate patients to providers' lists in real time. So as a provider is registered to see a patient, or when a provider begins a medical note, they're able to go ahead and complete the information for that patient to get it over to the billing team. With our coding, the codes that are suggested using our AI coding engine, the providers aren't having to search for codes. They're right there for them. All they have to do is approve them. They can make any adjustments they need to, but again, that's a very fast process. It can be done in well under 20 seconds. And then in terms of workflow, the entire process is streamlined from charge capture to claim submission. We have various workflows that will meet the need of our customers. And we have rules that can accommodate specific challenges that they may face with their previous systems or previous workflows they've had. So one thing that we do stress is let us put in as much automation as we can to reduce the amount of time you're spending on these processes. With the alerts and notifications, again, one of the really nice things for administrators, for example, is scheduled reports. If there's a specific report that you're going to need every Monday at 7 a.m., all you have to do is go into MediMobile and schedule it. And when you log in at 7 a.m. on that designated date, that report will be waiting there for you. In terms of the providers, the missing bill alerts when there is an encounter for a patient to be billed, the provider is well aware. We have widgets and different colors to indicate what type of encounters are on a provider's list. But all four of those things come together to really save both providers and administrators a lot of time.
Yeah, and it's just amazing. And just to tie in more MediMobile podcast, last week we covered how fast and easy it is to bill with MediMobile. So be sure to check out last week's episode for a live look at our technology. And just to wrap up this episode, our last question, what advice would you give to healthcare practices looking to invest in MediMobile and maximize their ROI?
Talk to us, reach out, schedule a demo. Let's talk about some of your pain points. Let's make your process as efficient and cost saving as possible. Let's put in the automation. Let's do the AI. Let's get your providers in a position where they're able to spend more time with their patients or go home earlier. Let's do all these things together. So the first step, of course, is that demo, then working with our sales team, then our amazing implementation and account management team. And of course, we have an amazing support team that support all of our customers at all times. But with implementation, what we do, because MediMobile is so customizable, is once that contract has been signed, you do get a dedicated account manager as well as an implementation team that will ensure that everything is set up the way that you need it set up. We do always make our best recommendations to our customers, but again, there is customization available based off of your particular workflow. We do ensure that all of your team members are trained during onboarding. That can be group training, one-on-one training. We provide electronic training materials as well as video training. And then, of course, if you have providers or anyone within the organization that needs additional training, that is offered as well. With your dedicated account manager comes the ability to meet however often the customer would like to. Typically, we see weekly or monthly meetings, just depending on the needs. And then, of course, with that dedicated account manager, you have someone that's paying very close attention to your account at all times. You have a contact if you need something or you have questions that you can reach out to. If adjustments need to be made to workflows, your account manager and our solutions engineering team will work with you and your team to make sure that your workflow is efficient as possible and that you are utilizing all of the amazing features MediMobile has to offer. We have tools, our AI, and our real-time monitoring and our reporting. So our goal is to make sure that your organization has everything possible to make that process as efficient as we can.
Exactly. Perfectly said, Lauren. I feel bad to send you off on such a good note, but it's time to wrap up today's episode. Thank you so much for joining again. That wraps up today's episode of the MediMobile Podcast. We've uncovered the impressive speed and impact of MediMobile solutions in delivering rapid ROI within just 1 to 3 months. From capturing every charge to reducing claim denials and automating time-consuming processes, MediMobile is transforming the financial landscape for healthcare practices. And again, a big thank you to Lauren for joining and sharing her insights. If you're ready to see how MediMobile can bring these benefits to your practice, don't hesitate to reach out and start your journey toward financial efficiency. Visit our website to book a personalized demo or email us any questions at sales@medimobile.com. Thanks for tuning in, and we'll see you next time on the MediMobile Podcast.